Good morning, friends. Today we are going to discuss something which is pretty common. There is no resident or a surgeon who has not faced this problem, especially with the increase in vehicular traffic. Roadside accidents, aggressive behavior of the society resulting in firearm injuries, stab wounds, fist fights. The liver trauma has really gone up. Good old days, the commonest source of injury used to be fall. But today, it is the vehicular accident. It's a part of polytrauma. And I'm sure during your training, as and when you are in the casualty or in the emergency ward, you must be seeing these cases at fairly regular intervals, if not every day, definitely I suppose once a week or so. It is the largest solid organ, occupies a lot of interperitoneal space, but the good part is nicely protected. And in spite of that, this is one organ which is most often gets injured. We'll not talk about liver trauma in pediatric age group. That is slightly different as far as the management is concerned. We might touch upon at the end how does it differ from that in the adults. Before we discuss about the trauma or liver trauma, it's relevant to recall the anatomy of liver. Especially in liver trauma, the basic problem is bleeding. It is one of the most richly supplied organ. Almost 1/3 of the total cardiac output goes to the liver. This is the organ which has got 3 sets of vessels which are intertwined. 2 of them supply an oxygen, and one, in addition to supplying an oxygen, carries the nutrients from the gastrointestinal tract to the liver, that is the portal vein. The drainage from the liver is by hepatic veins, which are short, stumpy, and drain straight into the inferior vena cava. In addition to these 3 vessels, there is another duct which is also very important and is responsible for drainage of bile from liver to the duodenum, thereby not only assisting in the digestion of food particles but also in excretion of various toxic products from the body. Now, if you look at hepatic artery, on an average supplies 50% of the oxygen supply to the liver. The remaining 50% is supplied by the portal vein. Of course, these are not all fixed. There are variations here and there. And with so much of blood supplying the liver, there is no injury to the liver which is only involving either the hepatic artery or the portal vein. By and large, the injuries involved laceration of both these vessels. Fortunately, laceration of hepatic veins is relatively uncommon. And it is the laceration of the hepatic veins which often prove fatal. Now, just for the sake of revision, this is a hepatic artery which is dividing into two at the hepatic hilum, and just behind the hepatic artery is the portal vein which is dividing into left and the right portal vein. And from above you can see this is a hepatic vein which is dividing into left hepatic vein, the right hepatic vein and the middle hepatic vein. Because of its rich blood supply, the main problem with hepatic trauma is a blood loss. And the main challenge to a surgeon is how to control these hemorrhage. Having reviewed a little bit about anatomy as far as the vascular structure or vasculature is concerned, it is also important to know the segments of the liver. We are talking of anatomical segments, not the segments as described according to the falciform ligament. 2, 3 and 4 are in the left lobe of the liver. 5, 6, 7 and 8 are in the right lobe of the liver. Two and 3 and 5 and 6 are more anterior. The 7 and 8 are posterior, adjacent to the diaphragm. Segment 1 is the caudate lobe, which is the practically extraperitoneal, sitting right on top of the inferior vena cava, is so deeply situated that it rarely gets injured. It's relevant to know that because 7 and 8 are well protected, injuries are not as common by a direct blow from the front. The side injuries, as we discuss about the mechanism, are responsible for injury to the 7 and 8 segment, more often to 5 and 6 of the right lobe. I repeat, injury to caudate lobe is extremely rare. Most often caudate injuries are secondary to firearm injuries or stab wounds.